Now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, good morning and welcome to Boomer Life here on CIL 650. I'm Sterling Fox. This month of March is Brain Injury Awareness Month right across Canada, and that will be part of the focus of today's episode of Boomer Life, for which we are joined on the line from FalseCreekHealthcareCentre in Vancouver by Dr. William Yee. Dr. Yee, good morning.
Good morning to you. How are you?
I am well, thank you, sir. We appreciate your time and you're joining us today on Boomer Life. Tell us a little bit about yourself. You are well connected not only to False Creek Healthcare Centre here in Vancouver, sir, but also to UBC and Vancouver General Hospital.
Yes, I'm a staff radiologist, and I'm a member of Vancouver Imaging, which is the largest group of academic radiologists in BC. We're composed of 23 members. We all have affiliations with the University of British Columbia, and since August of 2013, we've formed this strategic partnership with False Creek Imaging.
So is Vancouver Imaging a company, or is it just a group of like-minded practitioners?
It is a company. It's an incorporated company composed of a group of radiologists.
Okay.
And we service two main academic sites, Vancouver General Hospital and also the site at the University of British Columbia.
I see. And also I should probably indicate that you are well known as a teacher. You've received many accolades for your teaching prowess. Where do you teach?
Oh, I teach residents and fellows at Vancouver General Hospital. Residents are physicians who have finished medical school and they're doing subspecialty training in radiology, so I interact with residents every day. Fellows are doctors who have finished the residency but want to focus on more detailed area of radiology, so I teach them too, and it's great being exposed to these enthusiastic young minds.
Indeed, I'll bet it is. You're the medical imaging director at False Creek Healthcare Centre, correct, Dr. Yee?
Yes, that is correct. I was chosen by our group to interact with False Creek, and also I service False Creek 1 day a week, and the other day a week that a radiologist from Vancouver General Hospital comes here and also looks at the studies.
So the radiology component of False Creek Healthcare Centre really is a 24/7 operation, isn't it?
Absolutely. As the medical director, I have my cell phone on all the time, and they can reach me 24/7. And so any referring physician who sends a patient to False Creek and needs an answer right away can contact me.
Dr. Yee, you're a Vancouver guy who started in undergrad work at the University of Western Ontario, but eventually migrated back west and took your medical, or part of your medical training here in Vancouver. On a personal level, sir, I'm curious, what draws a person to radiology? What it is about this aspect of medicine that you find so fascinating and that you were so drawn to?
I think radiology is fantastic because it combines both a tremendous amount of medical knowledge that you can apply to help doctors. We're doctors in the meaning that I can help or guide a physician in the disease process and help him reach the correct diagnosis. I'm also a patient's doctor in that I can interact with patients with my procedures, and I can actually help alleviate some of their symptoms with interventional procedures. It requires a tremendous knowledge base in both medicine and surgery, and so I think it's a fantastic specialty for people to get into. It also combines my interest in photography in that I image the body from the inside.
Of course.
Using various modalities, and I get to sit in front of a computer and play with images and look at disease processes, and I also get to interact with patients.
I was going to say, you probably also have to have a pretty healthy or well-developed technical side to yourself, because this very, very technical field of medicine, really the changes and the advances are almost daily, aren't they?
Absolutely. There are many technological advances, and they're occurring at a rapid rate, so it's very important for us to keep abreast of the most recent advances, and that's why being affiliated with UBC, we have a research commitment and also an academic mandate to fulfill, and it's a great combination.
Dr. Yee, tell us about the equipment that you have available to you at False Creek Healthcare Center.
Well, False Creek is proud to operate the only clinical 3T MRI scanner in the province of BC. We just recently performed an upgrade, and let me tell you a little bit about MRI.
Please do.
First, MRI is the three letters stand for magnetic resonance imaging.
Right.
And it images the body using a high magnetic field. The patient is placed in the presence of a high magnetic field, and it causes little protons or hydrogen atoms in your body to spin around. We then give the patient a little bit of energy, and that causes these protons to move around even faster. We release that energy, and the energy that we give these protons is used to form an image. We use specific little coils. You can think of it as a microphone to listen, and then using that energy that is released, we can formulate an image. So in contrast to CT, MRI requires no ionizing radiation, and it allows us to image the body in exquisite detail.
Okay, so now that you've mentioned CT scan, again, this is pretty rudimentary stuff for a specialist like yourself, Dr. Yee, but what is the difference between an MRI and a CT scan?
Well, with a CT scan, numerous X-ray beams and a set of electronic X-ray detectors rotate around you, and they measure the amount of radiation being absorbed throughout your body. Sometimes the examination table will move during the scan, so the X-ray beam follows a spiral path. A special computer program then processes this large amount of data to create a two-dimensional image, which then can be converted to a 3D image with special software. And so the difference between CT and MRI is the CT scan uses X-ray imaging technology, X-ray beams, whereas MRI uses a magnetic field.
And I suppose I'm just trying to relate to how these get used on a regular basis. For example, in the world of sports, a player, a Canuck, gets injured on the road. He's flown back to Vancouver for an MRI on that knee or that shoulder. And then you hear about a person involved in a car accident, and they're going to the hospital for a CT scan, which would suggest something to do with the brain. Is it that easily broken up?
Yes and no. The advantage of MRI is its exquisite soft tissue detail. And so if we're looking for a soft tissue injury, MRI is the examination of choice, particularly in the high-performance athlete where they're worried about an ACL tear or meniscal injury.
Sure, yeah.
Then MRI is the best test available for that.
Okay.
If you're talking about the acutely traumatized patient where imaging must be performed rapidly and you want to determine if there's any bleeding within the body, you want to assess the bones and also any organ injury, then CT study is the most rapid and appropriate exam in that scenario.
How long does it take for a person who needs either one of those investigative therapies? How long does it take, generally speaking, to line one up and make arrangements and get it done at False Creek Healthcare Center, Dr. Yee?
Well, in False Creek, in our center, if a requisition is obtained from a referring physician, we can image the patient the next day, sometimes in the same day. I've had celebrities come in here, also high-performance athletes, and also non-celebrities, just people who want imaging quickly and they want the best interpretation available.
Right. Now, you were talking just before we started, Dr. Yee, you had a hockey player, probably a beer league guy, come in to see you recently. It wasn't one of the Canucks, so it was just a regular fella who plays a little weekend hockey who got banged up and ended up in the clinic. Tell us a little bit about that story and how you were able to help.
Well, hopefully he wasn't drinking beer because the guy was only 15 years old.
Oh, my, okay.
Yeah, but this happened about 4 days ago, and he was playing hockey. He was wearing a helmet. He was body checked into the boards.
Okay.
And he was experiencing some difficulty concentrating and difficulty performing some basic math at school. He also complained of some nausea and a sensation of the room spinning around.
So he gets injured on the weekend. He goes to school on Monday, and life just isn't right.
That's right.
Okay.
Yeah, something's off. So he comes to False Creek, and we have an urgent care center where he is assessed by an emergency physician.
This is Monday night, right?
That was yesterday.
Okay.
Yesterday night.
All right.
And so the emergency physician here then calls me and says, I'm worried about this fellow. Can we do an MRI study right away? And this was about 5 o'clock. And so we performed the study. And so I came in, and I took a look at it, and lo and behold, there was some blood in the brain.
Wow. So now, again, I'm trying to learn about the difference between the CT procedure and the MRI. If this young man had sustained some kind of head injury, and of course here we are in Brain Injury Awareness Month, so this is very topical, Dr. Yee. So this young man gets banged up in a hockey game, his head is hurt, and yet when he comes into the clinic, he doesn't get a CT scan, he gets an MRI. Why would the radiologist have chosen that route instead of the CT scan?
For one situation that MRI is preferable to CT is in the young patient. CT scan does involve ionized radiation. So in a young patient, you want to minimize the exposure to ionizing radiation. And secondly, with our 3T scanner, MRI has exquisite sensitivity for detecting things which cause interruptions in the magnetic field. And one of those things that it's very sensitive for picking up are blood products, known as hemosiderin. And so our 3T magnet can pick up really small amounts of bleeding, which may be undetectable on a CT scan.
Interesting stuff. So there you are. Now you've taken this, you've given this young man, this young hockey player, an MRI. You do the read of the MRI, and you discover bleeding on the brain. So what's the remedy from that point, Dr. Yee? What was the next step in attending to this young fella?
The next step is for him to see a neurologist. And that has been arranged. He will see a neurologist today, and he'll be followed up. He may require a repeat MRI exam if his clinical status changes, but now we have a cause for his difficulty concentrating and his change in status.
I think you've just also probably opened the door for a whole line of questioning here in terms of the support staff at False Creek Healthcare Center. The website, by the way, friends, is FalseCreekHealthcare.com. And if you flip over to the website and you start poking around, you will be amazed at the talent that is organized under that one roof at False Creek Healthcare Center. Dr. Yee, you are surrounded by an incredible team.
Oh, absolutely. False Creek is home to multidisciplinary staff of medical professionals, and they offer a broad spectrum of procedures. They range from vascular surgery to orthopedic surgery, male and female urology, ENT, general surgery, pain management doctors, and also radiology. And
that urgent care center that you mentioned earlier, where the young hockey player and presumably his parents showed up in the evening, that is also an important part of False Creek Healthcare, isn't it?
Absolutely. It's more of an acute care center, and it provides patients rapid access to assessment by a physician. Instead of waiting in the ER department for several hours, patients are seen right away, and they can have their imaging right away and interpreted in an expeditious manner. I was wondering what the parents' reaction were, given the fact that you were able, that they knew something was wrong when they ended up with their son in your urgent care section down there at False Creek Healthcare Center. When mom and dad learned of the problem, as you had determined it, through the MRI, and you were able, therefore, to go, okay, here's the problem, and now here's what we need to do. Here's what you need to do first, and so on, and down the list, ever so quickly served up. What a relief that must have been for the parents. Absolutely. They were happy, relieved. Yes. Yep. Okay. So now this is the sort of service that one can expect. I think this is not a unique case at all, this young fella who gets banged up in a hockey game. No, not at all. No, False Creek, our mandate is to provide the best service we can. My imaging department strives to provide the best quality imaging to allow the physician to treat the patient and provide the best outcome possible.
Just before we take the break here, you've talked a couple of times, you've mentioned your MRI machine as being a 3T scanner. I assume, Dr. Yee, you're kind of keen on that because it's the very, very latest technology available.
Exactly. What I mean by 3T is that T stands for Tesla, and it's a measure of the strength of the magnetic field. The image quality of an MRI depends on the signal and the field strength.
Okay.
So a 3T machine has much more signal than a 1.5T machine. 3T images can provide extremely clear and vivid images and can often be done faster, so it decreases the overall scan time. Both are of great value for patients in terms of diagnosis and comfort, and 3T is ideal for imaging small bones, the breast, musculoskeletal MRI, neurological structures, and also vascular structures.
Interesting stuff, and the very, very latest technology available at False Creek Healthcare Center. Our guest is the Medical Imaging Director from False Creek Healthcare Center. It's a real treat to have Dr. William Yee with us on Boomer Life this morning, and there's lots more ahead on the program. Please stay with us. We'll be right back.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.